So a big part of your practice, I guess you have this minimally invasive, non-invasive part of your practice.
Yeah.
So what are you doing? What do you offer?
Well, with facial things, there's been a definite shift over the last 20 years as what we're seeing in the office. Younger and younger people are coming in because now it's no longer just, do I need a facelift or not? There are so many more choices now. Botox is a very simple thing we can do. We have lasers and intense pulse light treatments that can take care of some of the sun damage that they've had. You know, people that are out in the sun a lot get little brown splotches, sometimes little red splotches. We can take care of all that stuff. When people get into the 30s and 40s, they start to notice some deflation of the face. They used to have nice big cheekbones. Now that's deflating, okay? And a lot of doctors say, oh, well, we need to inject some filler right here. Well, yeah, maybe, but I think a lot of times the problem is here, not here. So we inject filler in here, give them the apple cheeks back. They look 10, 20 years younger just with injections. This is not surgery we're talking about. Then when they get into late 40s, 50s, 60s, then the elasticity's gone. They might need some facelifting technique, laser resurfacing, something else to kind of smooth out the wrinkles. The eyelids, of course, are a big part of our practice. I can tell you a story. Back in 2008, 2009, when a lot of people lost their jobs, we had a huge influx of men coming into the office. Why? Because,
is that right?
Yeah, because they lost their jobs. They've got to compete with younger guys in the business world for, you know, when they're interviewing. And they said, you know, I look tired all the time. And I said, why do you think you look tired? Well, my eyelids, you know, and people ask me all the time, why are you so tired? And I'm not tired, but I look tired. I need to get rid of that. Eyelid surgery is very simple. We can even do that awake with people, local anesthesia, and off they go. A week later, they're back in social life. So that has changed a lot over time, where people will do smaller things just to maintain their look.
When should they start coming in?
When they look in the mirror and they say, boy, I look different than last year. And oftentimes, even in your 30s, you look at your picture, your Christmas picture last year or your holiday picture, whatever, and you look, wow, in a year I look different. I mean, life happens like that sometimes, you know. We go through changes, and all of a sudden, from one year to the next, you notice some changes. When you look at a picture of you, that's probably the time you need to start getting something done. Because ideally, you put your toe in the water first before you jump in the swimming pool. And most people, especially guys, they don't want people to go, what did you do last week when you took the week off? You look so different. Yeah, guys want to go, oh, you look refreshed, you look better. You know, we don't want to look done. We want to look natural. We want to look more rested. You want to look youthful, but you don't want to look plastic.
Yeah,
okay.
yeah.